One of the things I noticed while going through my breast cancer treatments is that although I could hear from the specialists what to expect, and I could look up the same things on Google, what I really wanted was to hear from a person who had been through it themselves and kind of hear that real life experience. So today, that is what I'm going to share with you. If you're just joining me here today and you didn't watch the last video I created, I would recommend going back to that one. It really outlined the 2 fertility preservation options I chose to do. Gave a little bit of the science behind it, not a lot, my interpretation of the science. And then I went on to say that I would be going into more detail into each treatment, which is what I'm going to do today. Lupron was a medication that was meant to suppress my ovaries during chemotherapy treatment. The goal was to keep the chemotherapy away from that reproductive system in order to preserve it for later use. I was told by my fertility specialist that the ideal time frame to get the lupron shot was about 2 weeks before the very first chemotherapy treatment. Because I was really on a time crunch and doing IVF, I didn't get that 2 weeks. My shot was administered about 1 week before I started chemotherapy. It was actually a really crazy day. I just finished getting out of the mini surgery room, getting my egg extraction. I was there with my husband, and not 20 minutes after creating those embryos and creating future life, it was time to put my body into a state of menopause to then preserve what I already had. So it's a pretty crazy switch of events. But I was a little bit drugged up from the IVF, so it was a good time to have my first lupron injection. So the very first one, I didn't know what to expect. It was a shot that needed to be administered by a nurse. And at that first treatment, I did receive it standing up. And this wasn't my favorite position to receive the shot, though it is very handy and easy. So what I did was put all of my weight on the leg that was not getting the shot. The shot was going to be injected into the top of my glute muscle. So on that side, I bent my leg to take the pressure off of that glute muscle, so it was more of a relaxed muscle, and then it would be easier for the shot to go in. Hello, fly. That is not helpful at all. The shot actually goes in pretty well. I'd say that there is kind of an initial ouch at the insertion when they punch it through. Then there is quite a bit of liquid, in my understanding, that needs to be inserted into the glute muscle. So the shot is left in the glute as they kind of plunge it down for a few seconds, and then they remove it, don't really feel that, and quickly put on, a piece of gauze or something. I would recommend wearing some dark underwear. It doesn't bleed a lot, but it did have a few drops of blood, and you might even want to bring a band-aid to kind of be prepared for that. After the initial shot, I did get a bruise within 24 hours, and the glute muscle was sore for a few days, I'd say. It didn't stop me from doing anything, but it was almost that feeling like if you worked out a muscle really hard and you have that delayed muscle soreness, it was almost a feeling like that. Another thing that I want to share with you is my favorite position to receive this shot. It sounds kind of weird to say it out loud like that. But imagine you are on the ground, kind of in that cat-cow position on your hands and on your knees, And then imagine laying on your side on a medical table. That was actually my favorite way to get the lupron shot. I found that I did not even feel it going in. I think it was mostly just because I was off my feet. My muscles were totally relaxed. And yeah, it was really good. The other thing that I would recommend that I discovered a little bit later on in my treatment was a freezing spray. So the clinic in Salmon Arm brought that out, and they pretty much just sprayed the area that the shot was going to be administered into, and it felt cold, and then it pretty much just numbed the area. And in that case, I definitely didn't feel it going in. So you might want to ask the nurse that's administering your shot if that's an option that they have for you. Before I get into this section where I'm going to share with you the side effects and some tips that I have, I do want to say that because I pretty much started ovarian suppression and chemotherapy at the same time, it's a little bit hard to differentiate between what side effect is coming from where. However, I was told that most of the side effects that are what one would expect if a woman was going through menopause were probably coming from the lupron injection. So that's what I'm going to talk about today. But be aware that it could be a little bit different, perhaps if you are having different chemotherapy than I did in conjunction with your shot. But I'm going to share with you what I believe were the side effects from the hormone suppression. So the first one that was extremely evident is hot flashes. Now, when I heard about hot flashes, I did not expect that it was going to be as aggressive as it was. These hot flashes would come on out of nowhere, instantly hot. Face absolutely steaming, flushed, rosy. I would almost be perspiring from my face. My glasses would fog up from the heat coming off of my face. I would instantly be like ripping off layers of clothes because I was just so darn uncomfortable. This would happen at night too. I would say primarily it happened at night. I would wake up out of a dead sleep and rip off my clothes. I was just sweating from head to toe. Underneath me on the sheets were a little bit sweaty, and I would basically have to get out of bed because it was just too much. So a couple of things that helped in these instances for me were immediately removing clothing if that's possible, if it was during the day. So if I was wearing a scarf, take the scarf off. If I was wearing a hat, take that off, layers off, and then chugging a glass of cold water. Similarly, at night, if it happened, whip the covers off. It helped me to get up and out of bed. I would head into the kitchen or have some water in the bathroom, chug some water, and just be up and about. It would typically last for, I'd say, anywhere from a minute to 5 minutes. Sometimes a little bit longer, but that was kind of the average that I found. And then the body temperature would cool down. It was, all I can say, it was crazy. Yeah, it was crazy. Another thing that I found that's quite similar to this is what I refer to as hot hands. And actually, hot hands is still something that I get now, well after this treatment that I started. And it's pretty much where my hands are, they just feel really hot and uncomfortable. Sometimes they get sweaty, they're flushed, and I notice it once again primarily at night. Something that I found helpful for this is even before I go to bed, I run my hands under cold water, like uncomfortably cold water, for an uncomfortable amount of time, a couple minutes at a time, until my hands get like icy cold. And I find that this really helps bring my body temperature down, bring my hand temperature down, and alleviates that uncomfortable feeling for a good amount of time. As you can probably see, the sun is peeking out and going behind clouds out there, so the lighting's varying a little bit. Another side effect that I experienced that was really frustrating was insomnia. And I think the reason why it was so challenging and frustrating and life affecting was because it is a side effect of the chemotherapy that I was having, and it is a side effect of the lupron or hormone suppression. So it was a little bit of a double up. And while I was going through chemotherapy, I didn't really find a remedy to help with it, as I was a little bit limited at that time. However, what I did find helped was really controlling or doing what I could to suppress my hot flashes and hot hands, as of course that, factored into my ability to sleep. And the other thing that I found helpful was a prescribed sleeping pill provided by my doctor. I was told that it was highly addictive, so it is not something that I was able to take every day. She recommended that I have a few nights without sleep and then take a pill to get a night of good sleep, and then a few days off and then have another one if I needed it. And that is what I decided to do, and I did not feel like I was addicted to that medication, but it was so nice just to have on hand for those days where I just couldn't bear the frustration. So that is something I would recommend having in your back pocket or talking to your doctor about to see if that would be a good fit for you. So I got to the end of the video and I forgot to add in one side effect that nobody mentioned. So I had to record this for you. I noticed that my body completely dried up. It was like there was some sort of mechanism that attached to my head and literally pulled all the moisture out of my body. I found that my face was always dry and I had way more little fine lines that I had never noticed before. The same thing was all down my body. My skin was always dry and flaky. I found in my midsection and on my legs where I have some stretch marks and some little, fine lines. It wasn't supple skin anymore. It was really dry and there was more wrinkles, and it was so evident. It was really interesting. So I decided to get a nice skincare system just to treat myself, and it felt really good to do that as I was kind of attacking. I felt like I was attacking the body from the inside. It felt nice to have something nourishing, some self-care that I was doing on the outside. So if that's something that speaks to you, I would definitely recommend doing that. And then I would also recommend getting like a body moisturizer that's really nourishing to look after the skin on your body as well. Since in this video we're talking specifically about ovarian suppression for the purpose of fertility preservation, next I'd like to share a little bit about the effects on my menstrual cycle during the treatment of the lupron. So as I mentioned, the ovarian suppression is meant to put the body into a state of forced menopause. But in doing so, it's meant to protect the body so that it can come out of menopause after chemotherapy treatment. However, chemotherapy does have the strength and the ability to damage the ovaries, so much so that the body isn't able to come out of menopause after chemotherapy. And that was one of my bigger fears, was that lifelong damage to my fertility and to my body. And coming out of menopause, being able to have kids was something that was really important to me. So I was told that after the injection, it was very likely that I would lose my period for the duration of time on the lupron. And that is true in my case. I had my injection, as I mentioned, 1 week before chemotherapy started. 2 weeks after my first injection, I had my period as scheduled, and then it did not come back for the entire duration of the rest of my lupron injections. My last lupron injection was given to me 2 days before my last chemotherapy shot. My fertility specialist said that it was very important to have that last lupron shot in my body before my last chemotherapy treatment. I was told that it can take a number of months for the menstrual cycle and to come back and to get my period, even after the lupron shots were done. 1 month passed, 2 months passed, 3 months passed, and I was starting to get a little bit worried. But I'm happy to say 3 months and 10 days after my last lupron shot, I don't know if I've ever been so happy to be given the gift of my period. It came back, and it was a really good day. So, as I mentioned before, I can't say if adding this lupron treatment on top of my chemotherapy treatment preserved everything that it needed to for us to be able to have kids in the future. But getting my period back and not being in menopause at the age of 34 is an absolute gift. So I would, if given the option to do that again, even with the extra side effects it gave me, I would 100% choose to do this treatment again, not knowing if it helped with my fertility, but even just getting my menstrual cycle back and coming out of menopause is an absolute blessing. I sincerely hope that you found this helpful. I send you so much love. This journey isn't for the faint of heart, but I have tons and tons of belief in you. If there's any questions that you have that I didn't answer, feel free to put them in the comments below. I'd be happy to share more if it's going to help you. If you found this video helpful, give it a thumbs up so that other people who are looking for this kind of information can find it. If you'd like to join me again next time for more breast cancer inspired videos, hit the subscribe button. I wish you all the best in your journey. Take care of yourself, and we'll see you next time.